A nurse is assessing a client diagnosed with colon cancer. Which of the following findings should the nurse expect? A. Steatorrhea. B. Elevated hemoglobin. C. Hematochezia. D. Weight gain. The correct answer is C. Hematochezia. Hematochezia, or the presence of bright red blood in the stool, is a common symptom of colon cancer, especially if the tumor is located in the lower colon or rectum. Steatorrhea is more associated with malabsorption syndromes. Elevated hemoglobin is not typical. In fact, many colon cancer patients experience anemia due to chronic blood loss. Weight gain is unlikely. Unintentional weight loss is more common. Question 2. A nurse is assessing a client admitted with peripheral vascular disease. Which of the following findings indicates a venous vascular disorder? A. An ulcer at the tip of a toe. B. Hair loss distal to the client's calves. C. Leg pain at rest. D. Edema of the ankle. Question 1. A nurse is caring for a client with a chest tube. The client asks why the fluid in the water seal chamber rises and falls. Which response should the nurse provide? A. This means your lung is fully expanded. B. This indicates a possible leak. C. Suction pressure that is too high causes this. D. Your breathing pattern causes this. Correct answer. D. Your breathing pattern causes this. Rationale. Fluid in the water seal chamber rises and falls with breathing, called tidling, and it's completely normal. A lack of tidling may suggest full lung expansion or a blockage. A. Full expansion often stops tidling. B. Bubbling, not tidling, suggests an air leak. C. Suction affects the suction chamber, not the water seal. Question 2. A community health nurse is reviewing home care instructions with a client newly diagnosed with heart failure. Which is the priority topic for teaching? A. Daily sodium restriction. B. Daily exercise routine. C. Changes in weight. D. Fluid intake record. Correct answer. C. Changes in weight. Rationale. Sudden weight gain is a red flag for fluid retention and worsening heart failure. A 2-3 pound gain in a day or 5 in a week is serious. A. Sodium restriction is important but not the first priority. B. Exercise helps long term. D. Tracking fluids is helpful, but weight reflects fluid shifts faster. Question 6. A nurse is teaching a client about using a transcutaneous electrical nerve stimulation (TENS) unit. Which statement should the nurse include? A. Apply lotion to the site before attaching the electrodes. B. This device requires a 220-volt outlet. C. This device delivers heat through electrodes. D. Adjust the dial until you feel a pins and needles sensation. The correct answer is D. Adjust the dial until you feel a pins and needles sensation. TENS units deliver low-voltage impulses that block pain signals. The goal is a mild pins and needles feeling. A. Lotion interferes with electrode contact. B. Most units use standard outlets or batteries. C. TENS gives electrical stimulation, not heat. Question 7. A nurse is teaching a client after a total hip arthroplasty. Which instruction should the nurse give? A. Use a raised toilet seat to keep your hips above your knees. B. Twist at the waist when standing. C. Move your stronger leg first when using a walker. D. Apply a heating pad to the operative hip. The correct answer is A. Use a raised toilet seat to keep your hips above your knees.